has been really at the forefront of what we've been trying to do here in Greece to address childhood obesity. I will not take long. I wanted to welcome you and maybe try to put our overall work through digital tools a bit in context for you. So we have started 3 years ago a national initiative to address child obesity rates in our country, in Greece. We have based this initiative on really robust global evidence and guidance, and we have tried, in partnership with the Ministry of Health, to frame the issue of child obesity as a public health priority that is cross-sectoral. So our program has really been centered on a wide range of systems, because we all agree, I believe, between us, that childhood obesity is a very complex and multifactorial issue that is also shaped by multiple environments. We have had to focus at the family level, school level, work directly with communities, address broader socioeconomic conditions, and we have also tried to focus on digital spaces that children and their families use. Maybe in terms of some very quick statistics to remind us that at the global level, there are currently more than 38 million children under the age of 5 overweight and obese. At the European level only, 38% of boys and 43% of girls between the ages of 6 to 9 in countries such as Cyprus, Spain, and Greece are overweight. So the rates are really alarming for our country, as we have one of the highest childhood obesity rates for children under 5, with an obesity prevalence that's nearly double the European average. So in Greece, for the under 5s, we have already 13.9% obesity prevalence. Thus, we joined forces with the Ministry of Health to address this issue. And what we have been trying to do, and you will soon see how all our digital tools and innovations have been helping us in that, is to really address all the different risk factors that have been leading us to this phenomenon. Diet is, as we know, a major factor. Children are exposed increasingly to ultra-processed foods that are high in sugar, they're high in salt and saturated fats. We also have physical inactivity that has been another key contributor, and something we've been looking into, as modern lifestyles that often limit opportunities for movement. We've also been looking into how psychosocial pressures such as anxiety or insecurity might also influence eating and activity patterns. And of course, we have also been looking into technology, which when we have excessive, for example, screen time, this can lead to sleep disruptions and can also be directly linked to eating habits. And of course, we have been looking into wider socioeconomic conditions, environmental and ecological factors. Now, the Committee on the Rights of the Child, as we know, has urged states to address child obesity by limiting fast food marketing to children and by regulating unhealthy foods in schools. So an overall message from us is that as the causes are multifaceted, our solutions must be holistic and coordinated. And this is what we've tried to do in this program, including through employing a wide range of digital solutions that have really been at the forefront of our efforts. Through the platforms and applications that we have developed, we have managed to support healthier behaviors. We have also managed to improve access to services, and you will soon hear from my colleagues how we have established and launched teleconsultation solutions, a teleconsultation platform to really enable access to dietitians and to improve access to personalized nutritional care. We have also developed a mobile application to support the adoption of healthy behaviors. And we have also managed to strengthen decision making that is data driven, because we also collect very important information from the pediatrician and the dietitians under their program in order to really support thereafter the shaping of important policy decisions and programs. We have developed tools and solutions that we hope will be scalable and that are user-centered. And we've tried to move beyond traditional and procedural digital services to really having a user-centered approach that can both support behavior change, but it can also have a longer-term impact in our work. I will not take longer because we are very happy to have here both our advisors, and thank you very much, Karen, for all your support in organizing the webinars series. And we also are happy to have with us Dimitris, and I think Dimitri, you go next. Dimitris is our technology for development specialist based here in Greece with us, and he will be demonstrating to you the range of these digital solutions that we have put in place, but I really hope can provide some inspiration to you. That's the purpose of why we're having this webinar series. We want to offer to share this knowledge with you. We want to share the solutions with you so that your respective teams can then see whether they can be adjusted and applied to your context. So thank you very much. That's all from my side, and over to Dimitri, and welcome again to this webinar. Thank you.
Perfect. Thank you, Aspa. Welcome, everyone. I'm Dimitris Karakostis. I'm the Technology for Development Officer here in Greece Country Office. I would like also to welcome you in this session today. This is the third webinar. As Aspa mentioned, there is a series of webinars, and today we're going to talk about the digital innovation and the tools that we have developed here in Greece Country Office in the frames of the childhood obesity program. I have to tell you that we're very excited about the webinar today. The team here in Greece Country Office has been working, I would say, full engines on the last 1.5 years in order to be able to deliver on time. And we are very proud of the results and happy to share this with you today. So I'm going to turn off my camera now for the presentation. And let's start. So today we're going to have the webinar, which is going to be split in 3 different sections. The first section is going to be a short introduction. We're going to talk a bit about the digital solutions in the childhood obesity program, as well as our stakeholders and partners. Then we're going to move on and we're going to present 2 of our flagships products. This is the mobile app and the teleconsultation platform. And then in the end, we're going to close with some key insights, including the lessons learned and challenges that we have faced during this admittedly very challenging implementation of digital solutions. Now, during this process, if you have any questions, of course, there's going to be a Q&A after, but you can also write the questions in the chat. And I have here with me my colleague, Eleni Chronopoulou, who is going to also try to support answering some of the questions. And then also maybe some other colleague is going to join in order to take care of questions that they are like related to the scientific context of the things. As we said, I'm the Technology for Development Officer, so we have the scientists also working on the specific context. The presentation is part of this broader webinar series, which already we had 2 of them, and now this is the 3rd one, as we mentioned. And essentially, the child obesity program in Greece is structured around several pillars. We have six main pillars. We call them pillars or work packages. And today we're going to talk about work package 4, which is the digital actions and the digital solutions. But it's important to understand that in general, the action places a very strong emphasis on the digital solutions. And this is very much in alignment with the Ministries of Health here in Greece broader digital transformation strategy. And in our program, although we often talk about the work package 4, the pillar 4, which has the digital solutions, we can find actually digital solutions across also other work packages, because each of these work packages has different deliverables, and digital tools, websites and platforms are used in order to support the delivery and the goal of each work package. So although we are actually going to talk today about our teleconsultation platform and the mobile app, we can see that we have digital solutions that they have been implemented in the frames of this program. Also like in work package 2, where we have our educational platform, and also like in work package 5, which is essentially the actions website, and it serves as a point of entry for all the other also digital solutions. So one thing which is, I think, quite important to understand, it is what is the purpose of all of these different digital solutions, and how do these digital solutions, they support the overall action. And I would say that through the digital solutions, we're actually connecting all the components of the action into a unified system. The digital tools, they will remain after the end of the program. They will be handed to the Ministry of Health here. And in this way, we ensure sustainability and continuity of the services after we do the delivery. And by ensuring sustainability and continuity, and by having these digital tools, we're actually enabling having effective collecting data and using this data in an effective way. And by doing that, by having data, essentially, we are able, or to say it better, the Minister of Health will be able later to use this data in order for decision making, policy development based on evidence. So it's absolutely crucial to have all these different digital tools. And the way I see that is a digital backbone of the whole action. A digital backbone with different components. The first thing is it enables the data collection in a way that the data are stored in one database, in one system, meaning that we're talking about one source of truth when it comes to data. With the systems that we have developed, we are ensuring that the data, they are going to be unique, and they're going to be stored and shared through the systems of health here in Greece. And this is going to give not only continuity of the project, but also accessibility to the data after the finalization of the project and the handover. And by having all this data and the continuation of the program, which will enrich the system with more information and more data, we will be able, and they will be able to conduct analysis and to have new policies which are going to be tailored and context specific, which is something very important in Greece. Although Greece is a small country, it's a very geographically diverse country. So horizontal policies, sometimes they do not work. And we're going to talk about this later, and how these digital solutions, they support in making custom policies depending on the context and the location in the country. So we're talking about digital solutions that they are going to be available to the citizens, to all the citizens, such as the mobile app that they are able to download from their phone, in their smartphones, or digital solutions that they are accessible also for through services from the Ministry of Health. And then hopefully, this is like a bit of blue sky thinking, with the advance of the technology and the good usage and safe usage of AI and big data, maybe it will be possible to analyze this big amount of data that they will be collected for further analysis, pattern recognition, and again, understanding the very important problem of child obesity in Greece. So in short, if we can put everything in one sentence, the digital solutions aim to create lasting impact by enabling evidence-based decision-making and supporting the design of tailored policies that respond to real needs while ensuring continuity and sustainability. So I'm going to move to the next topic, which is about the stakeholders and partners. In my humble opinion, this is one of the most exciting parts of the whole project. It was extremely beautiful and challenging to work with all these different partners, but it was absolutely necessary in order to reach to the point that there is unanimity and understanding. So we have in this project stakeholders and partners from all the major industries. We're talking about multidisciplinary teams with different expertise. We have stakeholders, of course, from the public sector, the Ministry of Health, who is the donor and providing the strategic guidance on this project, the Ministry of Digital Transformation, and state entities such as IDICA, which is the Government Center for Social Security Services. We all had to collaborate very closely together in order to ensure the integration of these systems with the existing governmental systems. We had the universities, the University of Haracopio, and also the Center for the European Center for Obesity, which was funded in the frames of this action, and also, of course, the private sector with the implementation partners, the service providers, that they built these applications, and consulting firms that they were advising us for specific technical or other topics during the implementation. And of course, UNICEF, the Greece country office, the colleagues from ICARO, that from the regional office, that they were available to support us also on scientific, technical, and other matters, as well as very important, our Children and Youth Advisory Board, which is a group of teenagers and children here in Greece that they support UNICEF in different aspects, and they have also supported, very importantly, here in this digital solutions by providing the feedback, by reading the content, and giving like very constructive comments. More specifically, as I said, the public sector is our funding and strategic, has the funding and strategic oversight. They have, I'm very glad to see some of the colleagues here in today's presentation, a scientific team of experts, including dietitians, nutritional experts, pediatricians, that they were actively participating in the process of creating all of this content and the methodologies. They have provided the scientific committee for accepting the final outcomes from the side of the ministry. And of course, they provided a lot, there was a lot of collaboration for the access to the existing infrastructure, as well as they had, a very important aspect, the data sensitivity. So they had, together with the data protection officer, the overall oversight. UNICEF, on the other hand, we had the overall coordination. We ensured all the deliverables and the processes, they keep the highest standards, the ones of a United Nations agency. And of course, we are responsible and we have contributed in project communication and visibility. Our colleagues from the University of Haracopio, again, with a team of researchers, including dietitians, doctors, and nutrition experts, they have, and in collaboration with the colleagues from the Ministry of Health, they have done amazing work in putting everything together, creating the content based on bibliography and existing research, and creating attractive, I would say, content for this application and methodologies that we should follow. And then of course our private sector, which consisted of teams of project managers, developers, solution architects, and our consultancy support, uh, being there always, for any technical issue we had or legal issue that we should actually clarify. So we're talking about a very complex and diverse set of stakeholders and partners that required a very solid governance and management. And I believe we have done quite well. And we're very happy about it. We're also very happy that we had all the stakeholders, because projects such that they cannot be solid, and the outcome is not going to be as powerful if it doesn't have a strong set of partners. So I'm going to move to the next section of this application. We're going to talk about our first digital solution today, the mobile app. This is a mobile app which the purpose is to support the adoption of healthy behaviors. Essentially, it's a user-friendly application available both in Android and iOS that supports parents and adolescents from the age of 12 to 70 years old to adopt healthy behaviors through two ways, let's say, information and interactive tools. The application is in Greek, but it's designed the system to have also other languages, but it's also adapted the content in the local context, meaning like that our scientists and our scientific partners, they have taken into consideration cultural, dietary, and linguistic considerations. We believe that is designed to be quite engaging and accessible. And we have even managed in the end to have some elements that they make it more attractive to the younger people, such as gamification elements, quiz, and other tools that we will see today. But before we go there, I would like to understand, to show you what is the problem and why, in the end, there was this need for such an application. And one of the biggest problem is that as of now, there was no centralized, trusted platform for having all this information concentrated, both for parents and adolescents. I mean, in Greece, simply we didn't have something like that. So there was a clear need from the Ministry of Health, given the fact of what Aspa said before, that child obesity in Greece is increasing, this is alarming, of creating such a platform. And then there is also the problem with the credibility. There is a lot of information out there online, but many of them, they're not credible. We have many influencers that they share this story, but in many cases, these are not scientifically backed up. So we wanted to have something which is like backed up scientifically, and we are sure that it's correct. Also, the information that is out there, maybe it's fine, but it's not always based on the national context of the country we live. In Greece, it doesn't take into consideration the Mediterranean diet, for example, or official guidelines that they come from the pediatric associations here in Greece. Another problem was the fragmented user experience. You have platforms that they do something very good, but it's for specific age groups, or they have like specific tools and not the tools that we wanted to have all together in order to have a full user experience for our citizens. And the last one, which I think should be the first, it's the limited accessibility that these tools that are available out there, they offer. Meaning like that, what we've built is a free tool that everyone can install. But out there are many tools that they are great, but they come with a subscription. And this is not, this means that there are people in the society that they might not have the financial ability to pay for these services. So these are the problems. And that's why we wanted to build such a tool. The tool is designed to do, let's say, three main things. First, to inform. Secondly, to support. And we do all that by having a set of cross-cutting engagement features that you can see here on the bottom. The informative content, it has the purpose to educate, and inform families. We have 4 different categories we will see briefly later. We have advice for adopting healthy behaviors. We have ideas for activities and games that both the parents and the teenagers they can use in order to, in a playful way, to adopt better habits, healthy recipes, and then there is a specific section with health literacy content of for different topics. When it comes to tools, we see them here on the right. These are tools that they have been designed to support families in adopting healthier habits. We have a goal-setting tool for behavioral change, personalized progress monitoring tools, nutritional plan creation, and I have to mention here, this is personalized nutritional plan creation, as well as location-based services to identify areas nearby where we live with playgrounds, sport facilities accessible to all. And all of this is somehow, it comes together with these cross-cutting engagement features that they include gamification elements. We have developed a badge system that you acquire these badges as you engage with the mobile app. So this gives an incentive, and also it's a way for someone to learn about the app and the different functionalities. We have quizzes that people can actually test the knowledges of what they have read and what they have just learned. Notification system, it's another aspect of more like active reaching to our users, and with reminders to update the progress with tips. And in the end, we made it so complicated, the whole app became so full of features that we had to build a guided onboarding walkthrough that essentially it takes you step by step and tells you what this app does and what its functionality does. But before I proceed with the functionalities, I would like to discuss briefly about a core element of this mobile app, which you will hear quite often. This is the 7 key behaviors. These 7 key behaviors, they were identified by our scientific partners at the ministry and at Haracopio University. And essentially, there are 7 behaviors that they are somehow related with obesity. And if you improve these behaviors, you might also get improvement in your issue with the obesity. And these are 7 behaviors. They're related with breakfast, having a healthy breakfast on a daily basis, having balanced meals during the day, sleeping enough according to your age, of course, reducing the screen time, the time that you spend in front of monitors, your phone, water intake, drinking enough water, having healthy snacks, and doing sports and having some sort of physical activity. So this concept, it's of the 7 behaviors, you can find it in different parts of the mobile application. And essentially, you can filter the content by these behaviors. You can filter your advice, the articles by these behaviors. You can set goals to improve these behaviors, and you can also monitor the progress for each of these behaviors over time. So it's a very, let's say, core element of the application. So now I'm going to talk a bit about the model of goal setting and how it works. And for that, we have used the 5 A's framework, or the 5 A's model, which essentially consists of 5 steps. In the first step, you're actually assessing an individual situation by asking some questions. We're going to see an example right after this slide. After you assess the situation of an individual, for example, if they eat breakfast every day or not, then you provide some advice based on their answers. And once you do that, you might want, you propose to them to have an agreement and a commitment in order to change and improve this habit. If they accept to have this agreement, they have to decide, for example, how they're going to improve it. And then they have a period of 2 weeks, which is essentially during these 2 weeks, they will try to improve this habit. During this time, you provide assistance to them. This is the 4th step of the 5 A's model, where essentially you provide information to them through articles, through informative material, in order for them to help them to achieve the goal. And during the whole process and in the end, you're having the arrange, the step 5, which essentially you're monitoring the progress, you're monitoring the whole process, and you are also evaluating in the end, and the user actually can evaluate if they have managed to reach the goal. It might be a bit complicated, but we can see it in an example. Here we have our 5 A's, and here we have a goal to improve our water intake. So in the first step, and I realize everything is in Greek, but I will try to describe. In the first step, we're actually assessing by asking how many glasses of water this person is drinking on a daily basis and how many glasses of sugar drinks they drink during the week. And once they answer, we evaluate the answers with a specific algorithm that was developed by our scientific teams. And then we're giving some advice, we're giving some recommendations, we're evaluating their numbers, their inputs, and also we're giving some sort of suggestion. And if they agree that they want to set a goal, we set these SMART goals. They are time-bound goals of 2 weeks. That the user can decide how they would like to improve. For example, maybe they can have an agreement that they will try drinking 6 glasses of water instead of 1 per day for the next 2 weeks. And then we have the part that we assist them. And this, although you can see it in different parts of the mobile app, we also have it here where essentially the user, we all have some difficulties in changing a habit. And there are some obstacles, especially with our busy daily lives. So we have identified these barriers, we call them these obstacles, and we list them here. So then the user can actually click on them and find advice on helpful advice on how they could just bypass or overcome this obstacle. For example, it might be that you want to start drinking 6 glasses of water per day, but your child, they just forget to drink water, it's just like it keeps their mind. If you click that, you get some specific advice and guidance on how you could face this and overcome this obstacle. And in the end, we have the arrange and monitor where everything is tracked and presented in beautiful graphs. This way you can monitor the progress over the previous weeks and months. But talking about tracking progress, I would like to show you also what we have done in that front. We have 2 ways tracking our progress of the 7 behaviors. The first one is a manual tracking, and the second one is an automated tracking of the behaviors. Manual tracking is a bit more boring because it means that you have to log in the mobile application and actually manually put this information in the system. But sometimes there is no other way to do it. There is no automatic way to track your breakfast, or there's no automatic way, as of today at least, to track the water that you are having. So this has to be manual, but because we got a lot of feedback, especially from our younger group, CAP group, that it would be nice if there is something like faster. We have also developed specific shortcuts within the application and widgets that you have in the home screen that allows you to do that, to add like this information to track your progress in a much faster way. For example, the widget works in a way that you don't even have to enter in the mobile application. You have the widget in the home screen of your phone, and then you are just clicking this plus button and you're adding, in this case, hours that you have slept. This way you make it a bit more user-friendly, and you try to support the users to track their progress, especially during these 2 weeks that they have set their goals. On the other hand, for some behaviors, it's possible to have automatic tracking. So in that cases, we have integrated some automatic tracking functionalities for sports and sleep. And for example, if someone has a smartwatch, and they wear the smartwatch while they are sleeping, then this information goes directly to the application, and it will appear inside the application in these graphs. Same thing with the sports, and also same thing with the screen usage of the mobile, of course. So the next, another core functionality of the mobile application is the personalized nutritional plan. We have developed a system where users, they can actually input their height, their weight, their sex and age. And then by answering a set of 8 questions, which are related with how many hours per day they sleep and what is their the level of how many times during the week they have intense, medium, and low activity. By answering all these questions and putting all this data, there is an algorithm that essentially is creating a nutritional plan, customized, personalized nutritional plan with information and menus for breakfast, snacks, lunch, and dinner. And so the user in that case, they are able to select specific menus. For example, here for breakfast, they have 6 choices, let's say. They can select one of these 6 choices. They see the ingredients below, and then they can also do the same for the other menus during the day, for the snacks and the lunch and the dinner, and create a daily plan that they can follow. And then the third core functionality is our maps. It's also part of the mobile app. This is like the concentration of sport facilities, playgrounds and parks within the app. So users, based on their location and based on postal code, to be able to identify where they can go nearby to have some sports. We are tracking and presenting, visualizing their basketball courts and football fields and other type of sport facilities, as well as playgrounds. I have to say here that was a major exercise because there was no centralized database. We had to collaborate with a network of 13 universities in Greece to collect this data. That was really to collect and clean the data. That was really impressive work as well. And it shows also like how this collaboration and how this program was really diverse, bringing a lot of different stakeholders contributing to it in different ways. So we're currently having these functionalities of finding nearby facilities, filtering these facilities, being able to bookmark them, as well as contributing new locations if you want as a user. It's quite impressive. And believe it or not, I mean, during this process, I realized that there are also many places where I live that I didn't know that they exist. So I somehow you think you know your neighborhood, but then there is always a playground behind some building that you didn't know that's there. So it's I'm sure it's going to be useful. Moving away from the from the tools, I will shortly talk a bit about the informative content that we have in the app, which I think together with the tools gives a very concise and complete picture. As I mentioned before, we have the advice that they can be filtered by behavior, by age, and very important as well, the content is different, the wording is different for different target groups, so for parents and for adolescents. The same goes for the ideas for activities. And then we have the healthy recipes, which have, apart from on how to make something, how to actually prepare this food, it has also information on the nutrition declaration, estimated cost, although the costs nowadays, they change very fast, but we do provide estimated cost to ensure like that people, they have, let's say, an estimation of how much it's going to cost each recipe to make it, and our health and literacy content, which has different type of articles there, For example, what you see here on your screen is related with the salt and in which type of food we find salt. And in the end, how much do we consume without even knowing? And then we have, as we said, our engagement features, which includes our badges and our healthy quiz and notifications, many things that we didn't have time to discuss today, such as bookmark functionalities and taking notes, allowing the user to take notes, as well as a very ambitious age verification mechanism, which is currently in development. And you probably hear all the discussions taking place in the EU on how to have automated age verification mechanisms, so to protect our kids from entering in social media in a very young age. So we're actually working very closely with the Ministry of Digital Transformation. They are implementing this project, and we want to integrate it in the application to ensure that there is a proper, robust age verification mechanism which cannot be bypassed. But even if it's bypassed, all the content is obviously very safe and very nice to read, but still very important to have this functionality. Now I'm going to proceed to the next platform that we have built. This is our teleconsultation platform. Another very ambitious project. The goal here is to support access to personalized nutritional care, and we want to do this remotely. Essentially, it's a platform that enables teleconsultation between dietitians, parents, and children, supporting the children and the families in addressing childhood obesity. The platform, apart from the teleconsultation, it allows the health data registration, monitoring, provides access to educational material. Of course, everything happens within the platform, so it enables the families to book the appointments. It enables also the dietitians to have their availability in the platform when they can have these teleconsultations, and also it facilitates ongoing communication and feedback. We have different user groups that they can access different elements of the platforms. We have the families, the pediatricians, the dietitians, and the data analysts and coordinators that they are able to download anonymized data and analyze for research purposes. I highlight, of course, the anonymized. It's a web-based platform which is heavily integrated with the national health system, which is something we wanted because this will ensure continuity and what we said before, one source of truth when it comes to data. Again, the problem before and why we needed that. One of the things is that there is unequal access to childhood obesity and nutrition support services in Greece. We have around 200 islands that they are inhabited in Greece, probably there are more, but Greece is very much mountainous. So there are many areas outside the urban centers that they are quite remote and difficult to provide the same level of service in all these areas, especially because maybe the population there is very little. So by having a teleconsultation service is actually we're trying to reach also these areas. Also, in today's lifestyle, that there is no a lot of time, giving the service to the families, to the parents, to have this online, it saves a lot of time. And this is the second reason. I will mention again the fragmented digital ecosystem and data silos that we are trying to solve by putting everything together in one place, and the absence up to now of consistent nationwide data on childhood obesity, which simply enough, the Minister of Health didn't have a concise, clear picture of the childhood obesity together with all the metrics that they are necessary in order to tackle the issue. And there was no also single point of access for information support on childhood obesity. And when I say support, I have to say here to become clear that the mobile app doesn't have the element of support meaning like there's no pediatrician behind there or dietitian. But in this platform here, we're talking about actually the involvement of doctors and dietitians in this process. That's why, I mean, the support here is much more active and is also much more specific. Essentially, we are talking about primary and secondary prevention. We have on the primary prevention, we're helping prevent obesity before it develops. We collect through the platform key information to better understand each child needs. We support the pediatricians in providing appropriate guidance. And also we're giving parents access to this personalized advice and educational material through the platform. And this is the primary prevention. But then we have the secondary prevention. And I will show you how it works in the next slide. But essentially, in the secondary prevention, we go to the children that they have they suffer from child obesity, and we provide these free teleconsultation services. This is for children from 2 years old to 70 years old. There is an assessment of growth and nutrition by the specialists, personalized guidance, and in the end, there is access to all of this practical information through the platform. So just quickly to see how the workflow is. A family goes to a pediatrician, number one. The pediatrician, they register in the system, in this new system, all data required. Apart from the height and weight, there are a lot of other data that they can be registered, including allergies and medical history of the patient, etc. All of this is integrated within the national health system. So there is these data, they are stored in the national health system. And then there is an algorithm that is executed and evaluates if the child needs actually, he has child obesity and they need further support through the teleconsultation service. So then the families, apart from actually having access to informative material, they're able to book an appointment through the platform with one of the specialized trained dietitians of the program. And then they organize the teleconsultation, which actually consists of 12 sessions. There are 12 sessions with the dietitian, and during this process, they provide the support. And this is how this service works. I'm moving towards now the third section, the final section of this presentation today, of this webinar, which is essentially the reflections from the implementation and delivery. We're going to briefly talk a bit about the impact of the digital solutions, the challenges we faced, and the lessons learned. And then we can open for questions, or if there is some time, maybe we can even have like a live demo of one of these digital solutions. So the impact of the digital solutions for me was like one of these wow moments when I realized that what we're building here is not the standard procedural type of tools that governments all around the globe they're building. It's not like the tool that even in the health sector, it records and registers all your vaccinations. It tells you when is your, it sends you the prescription from the doctor, or like a tool that allows you to issue some bureaucratic paper much faster. It's not that. It's actually, these tools, there is a major shift from procedural digital services to something user-centered. It's like the public, the state start caring in a personalized way and approach for the citizens. This is what we're trying to build, and I think in a big extent these tools, they do that. So there is impact in different levels. In the social level, we are supporting informed decision making through these tools. We are promoting healthier behaviors and lifestyles. We're empowering families and adolescents and by giving access to these tools, no matter where they live and where they are. And we're ensuring this access regarding of the geographical location. On the digital impact, we are advancing the effort that is happening globally when of preventive health services, and we're also contributing to national digital health strategies. And in the end, the policy and research impact, very important. We're actually generating valuable data. We're supporting evidence-based policy making and enabling in the future research and targeted intervention. So I believe like the impact of these digital solutions, they are quite big. But it wasn't easy to make it anyway. These are the challenges. I would say we have four main challenges. I'm not going to go into very much detail, but it's obvious that when we're working in limited time, and this is a common problem when you're working with such funds, but having so many stakeholders and so complex projects that it's like that there are going to be challenges in implementing and in finalizing on time, and that was really difficult. We had a lot of stakeholders, high-level stakeholders. There was like as we're designing and then developing, there were new requirements coming because there was a continuous process of testing and development and designing by all the respective teams, and that made it quite challenging. But it was also very rewarding when you see the result, because when you question something from all the different sides, you know that you have, and everyone then is aligned with the result. This means like that no one can actually challenge your solution and everyone is happy. But it wasn't easy. It required very good governance mechanisms, specific project management approaches involving both the agile and more classic project management approaches, and a very well-defined start, including the very first step, identifying the terms of reference for each of these projects. The second, and in my opinion, scariest aspect is related with the data sensitivity. We're talking about sensitive, super sensitive data, not only health data, but health data for children. So this is very sensitive. And ensuring compliance with data protection and privacy regulations. In Europe, we have the GDPR, so we have to comply with the GDPR regulations, and of course to ensure data security and confidentiality. And that was also very challenging. Of course, there was a very early engagement there with the respective partners for the data protection of regulations of the Ministry of Health. We even had specific memorandum of understandings with the Ministry of Digital Transformation to ensure that all of these, they are hosted in the governmental clouds, that they have a specific set of securities, specifically not only the governmental cloud, but the governmental cloud for health applications, which also has extra layers of securities. And of course, a lot of different mechanisms, including a parent consent mechanism for data collection and security by design during the implementation. Another challenge was the platform adoption. Of course, for everything that is new, there is some reluctance in using it. This comes also like from the users, but also like from the pediatricians, for example, that they might be used to another system to register the data. So also in that case, the early engagement is a key, as well as workshops, capacity building, and awareness campaigns, as well as what I mentioned earlier, our CAP group, the Children and Youth Advisory Board, which they were involved also during the process to ensure like that they provide the feedback in the design of these tools, specifically for the mobile app. And the last challenge is the sustainability, to ensure that the program will continue. And for that, again, involving all the different stakeholders from the initialization of the project, and establishing the right service level agreements for the maintenance, the technical maintenance of the platforms, as well as providing UNICEF guidance, providing us as UNICEF guidance and support to the ministry, I think it has helped a lot to ensure that these products, they will be actively maintained in the future. Okay, last slide. The lessons learned, which obviously there are much more than this, but these are some reflections. It's quite clear now that although co-creating with national stakeholders, it takes time and alignment, it is actually essential for continuity and ownership of the products. If you don't have that, things, they might just fall apart later. So it's very important to invest time on this and put energy on that. Otherwise, maybe you see some of your efforts like going wasted. What we've built here, and Aspa mentioned it earlier, is like something that we believe is transferable. Not all of them, because you saw some of them, they are heavily integrated with the national system, but some others, they are very transferable across context. And now that technology is everywhere and internet connectivity is also covering a bigger and bigger part of the globe, such technologies, not only that they can be used by more people in different countries, but they're also like, once you build them, to maintain them is not so costly. So there is a lot of space there. And then again, digital health, especially now with the advancements in AI, in artificial intelligence, and what they can do, what these tools of AI can do in data analysis, it means that there is a lot of there are still a lot of opportunities. I mean, digital health is relatively new, but now it seems like it's scaling up, and there are a lot of opportunities for the future, which is worth investigating. I think also UNICEF and exploring more. Last, I will close saying that the early stakeholder engagement and continuous feedback are key, especially where we work, in our domains, in our industries, where in many cases we have time-bound funds, and many things they can just like be delayed. So that would be like very important, the early stakeholder engagement and the continuous feedback, following best practices when you are doing your project management, following specific methodologies. And with that, I conclude. I'm not sure if there is enough time actually for a mobile app demonstration. I will leave this to you to tell me. Maybe we could start with some questions first. And thank you very much.
Thank you so much, Dimitri. I don't see any questions in the chat, so I was wondering if any of the colleagues had any questions for the tools that were presented. Otherwise, maybe we can proceed with the demonstration, because I think we still have some time left.
Sure. I would suggest, if possible. Okay, I see a question. Yes. Jan.
Hi, thank you for amazing presentation. It looks very, very impressive. I just wanted to ask one question. Maybe I have missed it. Could you please share how many consultations, online consultations were delivered? Do you have this information?
I don't have this information, but I have a colleague who I believe has the information. Eleni.
Yes, currently the nutrition teleconsultation, we have delivered almost, not almost, above 2,000 hours of 2,000, yes, hours of teleconsultations. Almost, I mean, we have this operation for 1 year. I mean, we started on March 2025, and till today we have above of 12,000.
Oh, okay, that's great. And just one more question: how many specialists are on the are involved in delivering these?
Yes, the direct services are delivered by certified dietitians and nutritionists, and we started, gradually, so to check the referrals that we will receive. So we started with 20. After 3 months, we had 40, and now we have 60 dietitians/nutritionists that they are delivering that sessions. But just to comment that and add that there is an interdisciplinary scientific team. So Dimitris mentioned that they are supporting the dietitians, and all of them, they had a full training. 3 days was the core training on the methodology that they are following. And of course, they have day-to-day coaching with specialists.
So one last question: all these specialists are on the ministry's bankroll, right? Like they're employed by the ministry.
They are employed through our implementing partner, Harokopio University, and the newly established European Center for Obesity that was established under the National Action Against Obesity. And the good news is that the ministry have, already shown all the positive results that we have through this service, and they have already proceeded in a legislative process, and they have already identified funds in order to sustain and continue that service. Because our program is ending the implementation, this month. So they have managed and did all the actions that they should do, and the service will remain functionable for at least 1 year more.
Amazing. Thank you very much.
Thank you.
Okay, perfect. If there are no any other questions, perhaps we could have like a 2-3 minutes break, and then I could start with a short demo of the mobile application. It's okay? Perfect. Okay. So see you back in 5 minutes then. Okay. Thank you very much. Okay, so I believe we can start. We can make it quite short. Perfect. Okay, so essentially, now what you're seeing on your screen is the login of the mobile application. We can go one step back. This is what you see when you download the application, and then you have to put your credentials, which you get, of course, after you do the registration. We're not going to do the registration here today. And once you do that, you are actually inside the mobile application, and you see the home screen. Everything is in Greek, but I will try to describe what you see. So in your home screen, you see the main functionalities of the application and provides an overview on your progress. Here on top, you see the badges that you have acquired during your engagement with the platform. Below, you see a goal that you have set in order to improve, in this case, the water intake. So you can see your goal up to which date the goal is active, and also an average of the water consumption based on your records. Below, you can set new goals. We have, if you remember from the presentation, the 7 behaviors: the balanced meals, the water intake, the breakfast, the sport activity, the healthy snacks, sleeping, and the usage of the screen. And you can actually, by clicking on the button below, you can actually start the process of the 5 A's, assess your situation, and set a new goal. And below that, we have our nutritional plans that we have also described. Here again, by answering the questions we saw before, by inputting your height and your weight, and selecting your answers in how many hours you sleep on a daily basis and how many times you exercise, you get your customized, personalized nutritional plan for breakfast, intermediary snack, lunch, afternoon snack, and dinner. And for each of them, you get several choices. So, for example, there is already a plan. Let me create a new plan. First, we answer a question if this person has allergies or no. If he has allergies, this process is not going to continue. So it's for people with no allergies. Here you put your height and your weight, and then you're answering the questions that we mentioned before regarding the sports activity and how many times during the day you're doing this activity. We have specialized questions for high intensity of sport activity, medium intensity, and low intensity. And then we also answer the questions of how many hours per day you sleep during the work days and also during the weekends. And then based on that, you create your nutritional plan that you see here, which you can store. So here it tells us that it was stored. And then you can actually build every day. You can select different options that you can see here. These are the ingredients for each option. You can select that, and then based on these options, you can build your daily plan of what would you like to eat. We have also vegetarian options, and this is how it works essentially. And in the end, you can just save that and see it in your home screen. The third functionality that I mentioned before are the sport facilities. This is the location of sports facilities, playgrounds, and parks nearby. This identifies our location, and then it shows the areas of interest in the based on our location. Here, for example, you can see that there's a basketball field here. And what is interesting is, like, first, of course, you can filter and you can identify specific type of of locations and sport facilities, but also you can also contribute new locations that they are not in the data here. And once you contribute here the new location, also by adding some information and photos, then there is a process of validation that takes place by the administrator of the platform. And if the location that is added is correct, then it will be visualized here as well. Now, I will show you a bit the content. For example, we can see the advice. As we said before, you can always filter based on different age groups. So from 4 to 6 years old, from 7 to 9 years old. And you can also filter based on different behaviors. So you might want to see content only for specific behavior. This is content related to breakfast. And then, of course, you have all these functionalities such as bookmarking and adding specific notes that you are able later to access from the main menu. It's very similar for the other content, for the other type of content. The recipes, again, is something similar. We have the different recipes. There are filters that you can use to visualize the recipes for specific number, with a specific number of ingredients, specific tags, as well as the price range that we said before, and how much time it takes to prepare it. And for each recipe inside, you get a lot of information on the ingredients, the preparation, and as well as the nutritional declaration of the recipe. I also mentioned before that there is a functionality of quiz, which you can access in different parts of the application. You can access it within the articles. After you read an article, you can test your knowledge, or you can access it from this centralized page. And essentially, the quiz works a bit like that. There is the question, and there is one correct answer. And by answering that, you go to the next. And in the end, you see if your answers, which questions they were correct. And this is the page that we show all the badges that we have. The ones that they are black and white, I haven't managed to take them so far. The ones that they are colored, I have acquired them. The user can actually click on them and see what they have to do to get this badge. It's part of the engagement that we are discussing before. When it comes to progress tracking, this is the page that you can see all the 7 behaviors. You can actually select one behavior, and you can see your progress over the time based on the week or the month. If you have a specific goal running for that period, you see it like with this visualization, this purple shade, meaning like that you're currently having a goal. You have set a goal for 2 weeks. And you can also add, you can add how's it called? You can add the data here or delete previous data. You can also, we talked a bit about the presets. So someone can actually do this, adding the data very quickly from here, or you can create new presets. So you don't have to go through the menu inside the screen to add the data. That's like a shortcut. And I think the last thing we could see briefly is like the different guides, the walkthroughs that we have created. So the users, they can actually understand the app because many elements, they might be a bit complicated to understand. So we have created these walkthroughs that people, they can enable them and provide information. For recipes, it's quite simple, but maybe we can try something else. Let's see. For example, this is for measurements. Yeah. In this case, the screen is grayed out, and then you can just follow the walkthrough, and the user have an understanding of the application and the functionality. Pretty much, this is the application. A lot of different tools, a lot of different functionalities, notification mechanisms up there. a very robust search functionality that is searching pretty much all the content in the application. And yeah, I believe I do not forget something. And that's it. Thank you very much.
Thank you, Dimitris. I would like to give the floor again to the colleagues in case there are any final remarks or questions. Yes, Osman, is it? Please.
Yes, thank you, Dimitri. Yes, great work, awesome work. Yes, I value the amount of work that has been put in this project. I just wonder about what kind of learned lessons or experiences you can share with us about, from the cybersecurity side of perspective on this project. If you have, something that can just be helpful for all of us. Thank you.
Yeah, thank you. Thank you, Mohammed. It's I briefly mentioned some of the challenges before, but essentially, since we're talking about very sensitive data concerning health and children, this is something that we have put strong emphasis since the beginning, and there are different ways we have approached that. Meaning like that, but from the beginning, when we were designing these applications in the terms of reference that we have actually drafted and written here, we had like a clear functional and non-functional requirements related with security, where this application is going to be hosted, and in every element and every part of the solution to have an approach of security by design, how the data are stored, how they are encrypted, as well as what are the mechanisms in the cloud service where these applications are hosted, in order to ensure that the data are safe. I think for us, what was very important and very useful, I might say it made things a bit easier, is like that these applications, they are hosted under the governmental cloud. So we have to, everything is there, which means like they're using specific technologies. I don't believe the colleagues know them, but it's like Azure technologies. But they also have their own security measures, apart from the ones that we have set, which is very important. We didn't start from scratch, I mean. On top of that, there is like the early engagement with the data protection officers at the ministry in order to ensure also that they are involved in this process. And what we are building, there is full compliance with these requirements. And as well as with our legal teams, we have worked quite closely in order to ensure that there is the consent mechanism necessary for storing the data. Again, there are consent mechanisms in different levels, but specifically from parents, they have to give the consent in storing the data. And all of this somehow was coupled. It was a very close collaboration with the Ministry of Digital Transformation and specific entities from the ministry, which was empowered through MOU. We had a memorandum of understanding. We had made official our partnership as UNICEF with this governmental entity, and we work together in order to ensure that the data, they are stored in a safe manner and transferred also in a safe manner. Thank you.
Thank you. In case there are no further questions or remarks, I suggest we close this webinar. We will, of course, share the recording with all of you. And we would like to thank you very much for being with us today. I believe it was a very interesting discussion and presentation. Thank you very much, Dimitri, for everything. Thank you, Karen. And thank you, everyone. We will see you in the next webinar, which will be held around 15th of May. Thank you.
Thank you very
Have a nice
much.
rest of the day.
Thank you much. Thanks, everyone.
Thank you.
It's great.
Thank you.
Thank you,
Bye.
colleagues.
Thank you.
Thank you. Thank you.